Hello and welcome to House Calls, Real Docs, Real Talk. I'm your host, Mercedes Fuller. Today, we're discussing stroke because May is American Stroke Month. Anyone at any time in their life can have a stroke. Age does not matter, but other factors do matter. So that's what we're talking about today. So let's get started. With me this morning is Dr. B.J. Hicks. He is a vascular neurologist and co-director of the Comprehensive Stroke Program at Ohio Health Riverside Methodist Hospital. Dr. Hicks, welcome to the show.
Thank you for having me, Mercedes. I'm looking forward to the dialogue.
Absolutely. Let's jump into today's discussion with health in the headlines. Good health is always newsworthy, so each week we select one current headline that ties back to our topic at hand, and then we bring it back to our table and we ask our expert to respond. This week's entry comes to us from our colleagues here at the AHA Newsroom, and the title is this: Mammograms may help predict heart disease stroke risk in women after menopause. Now, this is a very encouraging development, doctor. What are your thoughts on this?
Well, it's very encouraging, as you mentioned. This is a study that, we know so much about the importance of mammograms for breast cancer and overall screening for that. Our colleagues in cancer and oncology have so many tools for screening that unfortunately, um, those in the stroke world or the cerebral vascular world or the cardiovascular world aren't as privy to. And we don't have as good of evidence about a lot of screening tools that could be helpful. So we finally have this amazing connection between a screening tool for breast cancer that has been strongly trumpeted and strongly um, encouraged for all women to participate in to prevent breast cancer. And as a part of this routine study, radiologists or the doctors that read these studies, they can see that there's calcification in a blood vessel in the breast, and it shows up very nicely on the mammogram. And for years, and for as long as they've been doing mammograms, that really wasn't of importance because it had nothing to do with cancer. But those that studied this looked and saw that if you see calcification in about 20 or so percent of women, uh, that is discovered, one is 51% more likely to develop heart disease and stroke than those women that did not have that. So this really could change the game as far as having a good discussion, not guaranteeing that you're going to have a cardiovascular or stroke event, but it might be a tip of the iceberg. It might be a great discussion topic because women oftentimes use their OBGYN as their primary care physician. And women often have had a healthy life leading up to mammogram time, but that is also the time when a woman's stroke risk tends to rise a little bit. So for someone who may otherwise feel healthy, if they discover that, that might be a reason to check in with a primary care physician, make sure that your blood pressure is good, make sure that there's no diabetes or any other classic risk factors for heart disease and stroke. Again, it's not stating that this is a guarantee that one is in imminent danger. It just lets people know that there may be a trend towards this. So it's a great clue for women to utilize and for us in the medical community to look more deeply at.
Doctor, I love hearing some insights as it pertains to all of this revolutionary research that's moving forward. And definitely, being aware gets us closer to being a little bit more healthier in our lives. So thank you for your insight on this. Let's get into our main segment to answer viewer questions. We call this segment You Ask, We Answer. Dr. Hicks, let's get straight to it because I see so many queue questions in the queue just for you. Our first question comes to us from Springfield, Illinois, and this is what is being asked from out there. What are controllable risk factors for stroke, and what can we do to reduce those risks?
So there's a lot of things that one can do that are controllable. And that's, there's two major ones. If we take care of two things that I'm going to discuss, that knocks down your stroke risk by 80%, 80. The first is do not smoke. And if you do, stop immediately. The second is knowing your numbers as far as blood pressure is concerned. High blood pressure, smoking, up to 80% of the modifiable risk factors for stroke. Blood pressure numbers, it's very important. The tighter the blood pressure, the better. Guidelines for what is considered high blood pressure is a systolic blood pressure of greater than 130. That's a very important number to know. So keeping that in track as women, what often happens is they have beautiful blood pressure throughout their life. Then we get to menopause and that starts to change. Even though they don't feel it, blood pressure, we call it the silent killer because it doesn't give you signs and symptoms classically that your blood pressure is rising until it's too late. Other things to do is consume less sodium, lower your cholesterol, oftentimes with diet, sometimes with medications if needed. Losing weight, that's a spicy meatball, for lack of a better term. There's a lot to that, but losing weight does lower your risk, and that is a modifiable risk factor. And basically, just getting physically active. We have seen that you don't have to run marathons, you don't have to be a triathlete, you don't have to be an Olympic level athlete, but you do need to get physically active the majority of the week for at least 20 to 30 minutes a day of moderate intensity exercise, really getting the heart rate going, just getting moving. We as a society, especially in this country, have gone away from what I call free exercise, things that just naturally get the heart rate going, get your body moving. We've got to do that to reduce the risk of stroke. Those are the heavy, heavy items.
Absolutely. That answer was loaded with so much great advice. And, there were so many things that were sticking out to me, knowing your numbers, watching the diet, which is one of those things that I constantly say that I'm working on when I'm on the show. I'm working on my diet, but then also remaining active, keeping it moving. Great advice on that one, doctor. Here's another question for you. What are the warning signs for stroke, and do stroke symptoms differ for women versus men?
So the acronym that is used a lot for stroke signs and symptoms is Be Fast. And this is relatively new. Fast is used often, but in our line of work, which is stroke care, there are some other signs and symptoms that are sometimes missed. But Be Fast tends to get the overwhelming majority of them. And the B for Be Fast is balance. If you suddenly lose your balance, suddenly are off balance with no explanation for it, that is a stroke symptom. Eyes, if suddenly your eyes, if you lose vision, either out of one eye or out of a visual field, we like to say, an area of your vision, painlessly, just you suddenly lose that vision. That's a major issue. F for Be Fast is for your face. If your face suddenly droops, again without warning and suddenly, that is a stroke sign. A for arm weakness. I like to say arm or leg. If that is a sudden arm or leg weakness or numbness, that is another serious sign. S is for speech. And if your speech suddenly changes, if you have a slurred speech, some people say, like I was drunk, or it's a word salad, people like to say, the words that are coming out of your mouth are nonsensical. Or if you just can't get the words out, you're struggling to get the words out, in a cadence that you're typically used to, or a speed that you're used to doing that, that becomes a sudden problem. That is a stroke sign. So that sudden speech change is an issue. And finally, T, that the T in B fast is time, and it's not time to call my office. It's not time to look things up. It's not time to, call your doctor's office or your friend who might be in healthcare. It's time to call 911. This is an emergency. I tell patients all the time, when they ask for my card, my office contact information, I say, no, my card has 911 on it. That's how you contact me if there's a sign of stroke, because getting to the hospital as quickly as possible with professionals that can take care of patients, that's the way you get your expert level care as soon as possible. Be fast.
Doctor, I like that. That's easy to remember. I even have that memorized now. Be fast. And I know all the steps. I just don't have time to go over them again. But that was great. And you lift a very important point. Timing is everything. It's essential. Call 911 if we're starting to see some of these signs. Here's another question for you, doctor. What would you say to men who are watching about getting routine checkups and preventative care? Because men don't like to go to the doctor.
Yes, it's a terrible stereotype, and unfortunately, there's a lot of validity to it. That is a true statement. There are certain segments of the population where men are often trying to avoid that, and what has happened, sadly, because of the change in our society, like I mentioned before, since we're not doing as much natural exercise, since we're not moving as much, we live sedentary lives. Then guess what and what I like to call the fast foodization of this country. We're not eating as well, we're not moving as well, and then you add something like a smoking or other things, your risk for stroke gets pretty substantial. And what we've noticed is that the stroke age, your classic age, it's starting to get younger and younger. So people that naturally have a false sense of security because maybe their older relatives didn't have heart disease or stroke until later in their lives, all of a sudden now they're in their 40s and this is starting to happen. So that is a strong, uh, you know, a strong spiel to let people know how important it is to get regular routine checkups with a primary care physician, regardless of how you feel. The primary care physician is to keep you out of the hospital. And if certain things come up during screenings, they can refer you for outpatient specialists. Once you meet a stroke neurologist, that should have happened a long time ago, classically. So we want to keep people out of the hospital. We want people to be in tuned and in concert with best medical care, which that never involves being inside of a hospital. That involves routine care, checking those numbers for blood pressure, checking your diabetes, making sure you don't have it, checking cholesterol, and following evidence-based guidelines, which a primary care physician is apt to do. And it's extremely important. And in a lot of pockets of communities around this country, it hasn't historically been the typical practice. And like a lot of things, a lot of society's ills, we've got to break those chains, and this is no exception.
Yeah, absolutely. My friends, you've heard the doctor's orders. We have to pay attention and get some things into routine. That's so important. Doctor, here's another question for you. What are warning signs or complications during pregnancy or postpartum that indicate a woman is at increased risk for stroke later on in life?
So, an unfortunate, rare, but notable complication of pregnancy is hypertension. You know, pregnancy during hypertension can cause serious medical conditions, one of which is called preeclampsia or eclampsia. But just elevated blood pressure itself, preeclampsia, is a serious risk factor for stroke, and it's something that needs to be addressed during the time of pregnancy as well as afterwards. You have to continue with follow up to make sure that the blood pressure does not maintain at a higher than normal level. Because, as I mentioned earlier on, over and over, blood pressure is a silent killer. Blood pressure is a major modifiable risk factor for stroke. And too often, it rears its ugly head during pregnancy. Um, Another thing is gestational diabetes. Again, that is developing diabetes during the pregnancy. And if that happens, you have to get that aggressively treated through your OB and other specialists. And again, ensuring that after the baby is delivered, that's not something that is kind of forgotten and left by the wayside just because it's not giving you active issues and you're so worried about raising a beautiful new baby. This is very important to make sure that you can live a healthy and fulfilling life instead of having a stroke soon after that. There's natural hormonal changes that occur during pregnancy. So what we've noticed during our research in those in the close to delivery range, it's plus or minus 8 weeks, even 8 weeks after delivery, there is an increase of what we call a hypercoagulable state in some women, where your propensity to develop blood clots goes up. So we do monitor that very closely. So any evidence of signs and symptoms of stroke, you need to come back in. You need to get evaluated, and we need to make sure that nothing worrisome is missed. And finally, something very basic like a headache, a severe headache or a new headache. And a lot of times, again, a lot of women, they've got a lot going on. There's stress. There might be sleep deprivation. Um, they may have a previous history of dealing with headaches, but a new headache that comes out of the blue in and around this time, again, there is, because of the hypercoagulable changes to a mother, uh, that can develop blood clots in the veins of your brains that can cause the main symptom just being a progressively worse and worse headache, and that needs to be addressed as soon as possible. And we need to get the right brain and blood vessel imaging to rule all that out.
Absolutely. Now, doctor, you've said the S word a time or two. You said the word stress. Now, talk to us a little bit more about how stress contributes to stroke risk factors, and what advice do you have to help people reduce some of their stress, because we're living in stressful times.
That is a fact. We have started to look closer into this, and especially certain demographics, namely Black and also Brown and other historically disenfranchised individuals in this country. And we've seen that there is a uh, a significantly higher stress load amongst certain populations. Uh, Stress itself causes poor habits. You're not sleeping as well. You're not you tend to self-medicate with things like tobacco and alcohol and other things. You tend not to do sort of meditation and other techniques to keep the stress level down. Stress that kind of festers and is constantly a part of you. It tends to increase um, the cortisol level, which is a stress hormone in the body that historically humans have cortisol for the fight or flight syndrome. When back in the days when we were in and around animals or other sort of dangerous areas, a cortisol increase in your body would get us prepared for that fight or flight, where you either have to run or you've got to fight something off. But it's not healthy, really, and it's not appropriate in any other sort of scenario. But those that have stressors, or those that have felt slighted from the wrongs or the evils of society, they tend to develop these high levels of cortisol that don't go down like they should. After that fight or flight response, or that um, course of action, that should be gone. That should be low down. But if you're kind of consistently dealing with stress, you're feeling slighted in and around your life, things aren't going well for you, and you're just always thinking about family and finances and everything else, your cortisol level just tends to rise and hang. And when
Mm,
that happens, your blood pressure level stays up, your
mhm.
blood sugar level stays up. Again, like I mentioned, your sleep habits are poor and you tend to self medicate. So, all of these things, even if you're taking medications for, say, blood pressure or diabetes, it may not be working as effective because your underlying stressors are causing a problem. And all of this, unfortunately, can increase one's risk of stroke. It's a fascinating, uh, relatively, uh, you know, an issue as old as time, but something that researchers are just now getting hip to.
Absolutely. We have to pay attention to those stressors and those triggers that sometimes trigger other stressful behaviors. That's a great explanation on that, doctor. I appreciate that. Dr. Teresa in Selma, she wonders this. If I'm on a birth control pill or any other type of contraception, am I at risk of stroke? And are there specific forms of contraception that cause higher risk?
So there's a lot there, but I will say that overall, the risk of stroke in someone taking hormonal contraception is low. Um, However, it's not nothing. And if you do my line of work, which is stroke care, you do tend to see patients that have no other stroke risk factors other than being on uh, uh, a form of hormonal agent or contraception. Estrogen containing products or medications tend to have an increased risk of these, what we call thromboembolic events. So, an estrogen containing medication is one that, stroke neurologists tend to look very, very critically at if someone is coming in with a stroke like event. Now, again, like I mentioned before, the risk is low, but things increase that risk. Things like if you're a smoker in doing that, that risk increases notably. Interestingly, migraineurs with aura, if they have kind of a visual change or if they have certain neurological symptoms along with their migraine, those type of migraineurs, if they're also taking hormone contraception, that increases your risk of stroke even more. And add all those three together, that is a serious trifecta of of a stroke risk factor when you put them all in concert. Now, other things like if you're a diabetic, if you have high blood pressure, if you're have obese or have a metabolic kind of syndrome, if you have a known condition that makes your blood clot easier than others, of course, all of those things, and then you add a hormone contraception medication, that will significantly increase the risk. So these are important things to know and keep in mind. And if there is a concern, if there is a strong family history, if you've had a stroke in the past, that's absolutely something to discuss with the provider who is prescribing that medication, and maybe consider a non-estrogen agent or something else altogether.
You lift such an important point. Know your family history and be able to articulate even your own history, your own medical history. That's going to be important information to share with the doctor. Are women of color an increased risk for stroke?
That is there is evidence that there is an increased risk of stroke in women of color. A lot of that has to do, again, with society's ills. There are social determinants of health that have been well discussed most recently, but still there's a utter lack of strong concrete evidence around this. So there's going to be more and more that we know about, but we know things like your zip code has a disturbing effect on one's quality of life and also one's mortality rate and age when someone passes away, and also when someone develops a stroke. There are heat maps all around this country of historically Black and Brown communities that have been unfortunately neglected from appropriate medical care. That, again, those heat maps will identify areas where there's a high propensity of stroke. That's been well defined. So what one has to do is understand that there may be some risk factors there. We mentioned a little bit earlier about the stress that some Black and Brown individuals may feel just due to society's ills. So that, again, is another issue. We have to understand all of these things and know that all of them together makes the importance of routine follow-up care and appropriate and finding appropriate, compassionate, patient-centered care for you, the individual. That's of paramount importance. What I tell people all the time is that, it's one thing to go to see a physician or a provider But if you're getting substandard care, or if you're getting inadequate care, or if you're getting care that you quite frankly don't feel comfortable with, what do we say about the United States of America? It's a free country. It is a free country. There's no one that is um, connecting or tying you to that provider. You are free to seek a second opinion. I tell people that all the time. And the best way to find out is word of mouth. Find out from your group of friends, a group of family, coworkers. Hey, who's your primary physician? Who do you see for care? You're always on top of things. You've made great lifestyle changes over the past few years. Who's helping you with that? It's that sort of thing that we have to be very mindful of, and not just sit back and be despondent when you're getting substandard care from a provider. There are plenty of other fish in the sea.
Absolutely. Plenty other fish in the sea. Make sure you find the doctor that's right for you. Our last question, doctor, comes to us from Doug in Louisiana, and this is what he wants to know. What are the most important things a stroke survivor can do to prevent another stroke?
I'm often mystified when I meet stroke survivors who never followed up after their stroke, either through falling through the cracks of healthcare, or meaning that uh, after the stroke, no one really made sure that they followed back up with a neurologist, ideally a stroke specialist, to make sure that they're being excuse me, make sure that their risk factors are being properly addressed. So that's the first thing I would strongly recommend, is getting back in with a stroke specialist, or at the very least your primary care physician, and making sure that we know why the stroke happened. So that's a key thing. A lot of people don't aren't armed with that very important bit of information. Why did this happen? And once they find that out, it helps target and guide the clinician and the patient as to figuring out what we can do to lower this risk from happening. Once you know that, then you may know, oh, my blood pressure was from narrowed small blood vessels. And it's very important that I take an antiplatelet medication like aspirin or Plavix or Brilinta or what have you, and also be taking a statin medication, because that guidelines have been shown to lower the risk of that. Blood pressure management is of the utmost importance, so I've got to be very mindful that top systolic blood pressure isn't over 130, that I don't have sleep apnea, that my snoring is properly addressed, or that I've been checked to make sure that there isn't an underlying bit of sleep apnea, which is an increased risk of stroke, that I am adhering to appropriate Mediterranean diet principles and getting good exercise with, again, majority of the week, getting adequate exercise to keep the heart rate up. If the stroke was from a heart issue, making sure that I'm following up with my heart care specialist to ensure that if I have heart failure, that's being addressed. If I have atrial fibrillation, that I'm on a blood thinning medicine that is extremely impactful for lowering the risk of stroke. If I have AFib and if I'm not on a oral anticoagulant, as we call them, figuring out why, and make sure that why is a very strong recommendation and not just something that may have been mentioned in passing to someone. One thing that we often hear is that if someone has a fall risk, that they shouldn't be on a blood thinner, and we have strong evidence that that's often not the case. So, if your stroke was from a bleeding stroke that was from high blood pressure, again, making sure that you're aggressively lowering blood pressure and doing other risk factors. So that's the key, just kind of getting back in with the healthcare specialist that treats stroke, to at least give the ground rules and the guardrails to live a meaningful life moving forward. We have over 600,000, or nearly 600,000 stroke survivors every year. And, you're not destined to have another one, especially if you are trying to adhere to things to lower it from happening again.
Absolutely. Dr. Hicks, wow. Thank you so much for this refresher course on stroke awareness. To put the final touches on this topic, I'd like for all of you to take a look at this video about a young lady who had a stroke in the prime of her life. She has some great advice for all of us.
Before my stroke, I was a nurse at Boston Children's Hospital. I did CrossFit. I was healthy. I didn't think I could have a stroke at such a young age. It affected my whole left side of my brain. If you walk by me on the street, you can't tell I had a stroke. Everyone says, "You're so strong, you're like inspiring us." And like, I'm broken and beautiful. So if you see signs of a stroke, act fast. Facial drooping, arm weakness, speech difficulties, time to call 911 because time lost is brain lost.
Dr. Hicks, do you have any closing thoughts for us before we let you go today?
I think she said it beautifully. I could not have said it any better myself. I hope that our viewers and listeners take heed to some of the things that we discussed together. But, I think the way she wrapped us up, I could not have said it any better.
Thank you so much, Doctor, for sharing your time and your expertise. That does it for our show today, friends. House Call will be taking a summer break after this show, and I will be sadly moving on to some other opportunities. So that does it for our time together. But we promise that we're returning with a rejuvenated show full of new topics that we'll tackle and a new host. It has been my honor to host House Calls for the past year, and I've learned so much, and I hope you have too. Friends, take care of yourselves and each other, and don't forget to find any of our previous shows at the House Calls YouTube playlist. And I encourage you to subscribe to our YouTube playlist and share the content and the breaking news with your family and your friends, because we want everyone to be happier and healthier. Have a safe summer and be healthy, and we'll see you soon.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.